I will talk today about climate change impact on health in Egypt. Egypt is located in the Middle East, North Africa region, and is considered to be a potential hotspot of climate change. The total area of the country, approximately 1 million square kilometers, and the coastal zone of Egypt extended for more than 3,500 kilometers, where more than 40% of the population live. Administratively, Egypt is divided into 27 governorates, and according to the World Bank, at 2019, the population size exceeds 100 million population. An Egyptian-French collaboration project funded by the Academy of Science of Egypt, we make a project about health mapping of infectious diseases vulnerable to climate change. Through this project, we found that we studied 8 locations here: Alexandria, Mansoura, and Asia, and Cairo, Farfara, Asyut, Hurghada, and Aswan. We noticed that the maximum temperature and the minimum temperature in these 3 areas are increasing during the study period. We started. Oh, sorry. And through analysis of the time series through Climatex index of temperature extreme indicated that the number of hot days and nights in a year are increasing faster in Upper Egypt and along the Red Sea than the other country. The frequency of the extreme hot days in a year would reach about 80% of all at all sites in the last decade of this century. Regarding the annual precipitation, during the period of 1980 to 2017, we didn't found any significant trend, but there is a significant decrease is predicted to occur at 2010 and 2000. Here I'll talk about the schistosomiasis. It is an endemic disease in Egypt. Through a project done in collaboration between the Egyptian and French, funded by Academy of Science in Egypt, we found that detected that there is a change in the distribution map of schistosomiasis in Egypt. The incidence of the 2 forms of schistosomiasis was found to be affected by changes in the meteorological factors through the different mechanisms, mainly through the movement of snails due to increasing the temperature in the Upper Egypt, and so it changed their position to Lower Egypt, and also the migration of farmers from the delta to other areas due to the salination and erosion of agricultural land. Next, please. In another study previously published at 2014, we noticed that the relative frequency of bilharzia bladder cancer, a sequence of schistosomiasis, was detected with decline with time in most of the Egyptian governorates, but this is not, we couldn't prove that this is related to climate change. Through our recent project, we studied this in more details, and we found that there is that climate change and its sequence are suitable factor for increasing migration of population, especially farmers from Nile Valley to Delta, to other governorates, such as urban and new governorates. And this improves the occurrence of schistosomiasis in areas not found in previously, such as Red Sea and urban areas. Next, please. Next. Yes. About another disease, we found it as related to climate change, fungal keratitis. It is a type of fungi that affect the eyes, and we published this paper in at 2011. We found that through backward linear regression, a relative frequency of the recorded cases of fungal keratitis with time and atmosphere and humidity that we cannot neglect the potential risk factor for increasing these disease during the period of the study, and we found that the minimum temperature and the maximum humidity found to be good protector for future increase in the incidence of fungal keratitis, and therefore it was related to climate change in somewhat. Okay, next. Yeah, complete. Yes. About malaria, Egypt is currently considered to be among group 1. Group 1 is considered to be the countries in which only a few cases were reported in a limited residential foci during the past 3 years, and the program is strongly committed to eliminate the residual foci and to achieve malaria-free status. Egypt nowadays is is recorded by WHO as a free country of malaria. With climate change, with the climate change, there is potential for mosquito-borne diseases infection is likely to increase because of warming, rainfall, and the movement of population. Okay, next. In diarrhea, it was many studies found a relationship between temperature and precipitation diarrhea. And in our project, next, please. Next. Yes. We found that by statistical analysis that
Professor Amal, we can't hear you anymore. Professor Amal?
we found that, please return the previous slide. Yes, we found that temperature and precipitation can be used as predictor for morbidity of diarrhea in Cairo, Alexandria, and Governorate, but in the other governorates, we didn't find this relationship. So, next. Next. Egypt is interesting to achieve the Sustainable Development Goals, especially the goal number 13, through mainstreaming adaptation within the national planning process, developing required indicators, provide required census, support the institutions' knowledge and capacity building of these of different institutions, develop required monitoring and evaluation. Next. Through health in Sustainable Development Strategy Egypt Vision 2030, under the health axis, there are several programs, including apply a comprehensive health coverage, raising the quality of health surveys, strengthening prevention program and health. Under the environmental axis, the following programs are related to climate change: developing policy to reduce air pollution, combat climate change and to protect the environment, development infrastructure to support the effort to reduce air pollution and combat climate change, follow up and the implementation of environmental international conventions. Okay, next. Next. Yes. No, the previous one, please. Yes. For health, there Egypt is success to reduce the socio-economic vulnerability through the improving the gross national production per capita. Also, there is a decreasing fee in dependency ratio in the adult illiterate. There is safe water and sanitary access are increasing to cover all the urban areas and many of rural areas, and we are going to cover more areas, rural areas. Maintenance of national public health infrastructure is a crucial element in determining level of vulnerability and adaptive capacity. Therefore, the expansion on health care is increasing. The percent of population with access to health service through the ability of several health programs to eliminate endemic infectious diseases are increased also. Next. Yes. There are several programs for healthcare applied in Egypt from previous several years, as mass treatment for campaign for schistosomiasis was started at 1960, covers routine health immunization, mass treatment of lymphatic filariasis, TOTS for detection and treatment of tuberculosis, oral rehydration for diarrhea child cases. New projects are started since 2 or 3 years. Program for diagnosis and treatment of viral hepatitis, and this make the incidence of viral hepatitis and prevalence of viral hepatitis C decrease very low nowadays. Programs for detection and control chronic diseases such as hypertension and diabetes, program for early detection and treatment of breast cancer, and also next, okay. Next, please. A program for insurance of unemployed populations for health insurance, and also a program for vaccination against COVID-19. Next, please. Yes. Communicable diseases under surveillance of Egypt are divided into used as early warning system, and it is divided into 3 groups. Group A, immediate routine reporting required. B, weekly in cases of emerging or re-emerging diseases, we may be. Next, please. Please, next. Yeah, next. Yeah. The processes of climate change, the process implemented to overcome climate change in Egypt was started within 1992 and are ongoing through many processes, as this slide summarizes this process. Okay, next. Yes. Experted efforts. There are several reports in form of vulnerability and adaptation chapters in the first, second, and third national communication. NDC and FNC are going on. National strategy for adaptation to climate change and disaster risk reduction are also ongoing. National adaptation plan through funding projects and such as coastal zone, water resources, and agriculture and urbanization. Interactive vulnerable map. This map was the first phase was started at April 2019, and the second stage phase are started this year. Yes. Okay. Next. This summarizes some of the reports about climate change and health impact in the first, second, and national communication, as we talk about the direct at first, indirect at first, and through natural source system and human systems, and it was recorded in the second and third national communication. Adaptation strategy, all the adaptation strategies are also recorded, and how we are coping with this, with the international strategy to make minimize the health impact of climate change on and decrease the stress of that on the vulnerable population in our country. Okay, next. Next. Yes. The main goal for that was to identify the health risk expected to occur as a result of climate change, raising community awareness about the climate change risk and the means of adaptation, increase the efficiency of healthcare sectors, and improving the quality of health services for dealing with climate change, supporting the efforts of Ministry of Health and Population to improve the social and economic status and population characterization. Okay, next. But there's still some gaps in we need to be covered.
Professor Amal, we can't hear you. Professor Amal? Can you unmute again?
Yes, it's okay.
Yeah. Great, yes.
Yeah, you hear from me the gaps, or I must tell it. Okay.
You can move on to the next slide.
About the gaps, okay. These are the sources where I got my knowledge. Go on. Yes. And these are the publications that I get some of my knowledge from it. Okay, next. And thank you very much.